Enrolling in Medicare can be overwhelming and confusing. This video covers the basics of Medicare so you can understand how Medicare works and start on the path to finding the best Medicare coverage for you. Hi, I'm Tabitha Moldenhauer, broker with Benefit Consultants Midwest. If you haven't already, please take a moment to hit the subscribe button. We have new, helpful Medicare content every week. First, what is Medicare? Medicare is a government program that provides health coverage to people who are age 65 or older, and also some people who are under age 65 but qualify due to certain disabilities. Original Medicare has two parts, Part A and Part B. And we still refer to those as Original Medicare as opposed to the newer parts of Medicare, Part C and Part D, which were developed in the early 2000s. More on Part C and Part D later. Medicare Part A is hospital or inpatient insurance. It doesn't cover everything at 100%. There are deductibles and coinsurance amounts that remain your responsibility with Medicare Part A. If you worked 40 quarters, which is 10 years, and had Medicare taxes taken out of your paycheck for that entire time, then you qualify for Medicare Part A without having to pay a monthly premium. That's what all those taxes paid for. It's in the best interest of almost everyone to enroll in Medicare Part A when turning 65, even if you will still be covered under an employer group health plan. There are two possible exceptions. If you have not worked 40 quarters yet and don't qualify for premium-free Medicare Part A, and/or if you have a health savings account with your group plan and would like to be able to continue to contribute to it. If either of those describe you, it may be to your advantage to delay enrolling in Medicare Part A. Medicare Part B is outpatient insurance. Timing this enrollment is very important because you do have to pay a premium once you enroll in Medicare Part B, and you pay that premium every month that you are enrolled. In 2022, most people will have to pay $170.10 per month for Medicare Part B. The amount that you pay for your Medicare Part B premium is determined by your income. The chart on the screen shows what your Medicare Part B monthly premium will be if you fall into one of the high income categories. Because of this monthly cost, you don't want to enroll in Medicare Part B until you actually need Medicare Part B coverage. For example, if you are going to continue working past age 65 and will still have coverage from a group employer health plan, you may want to consider delaying your enrollment in Medicare Part B. More on that can be found in the video linked above and in the description below. Medicare Part B has a deductible that you have to meet before Medicare will start paying anything. Once that deductible is met, Medicare covers approximately 80% of covered medical expenses, leaving 20% or so as your responsibility. Coverage from Original Medicare Parts A and B really isn't bad. It might even cost you less in premiums and out-of-pocket expenses than your health insurance did before you were eligible for Medicare. However, there's one big issue with Medicare Parts A and B that causes almost all Medicare beneficiaries to enroll in coverage beyond just Original Medicare. There is no out-of-pocket spending limit with either Medicare Part A or Medicare Part B. So there's no limit to how much you can end up spending on your Medicare Parts A and B deductibles, coinsurance, and copays. In addition to not having any way to cap your spending with Original Medicare, Medicare Parts A and B do not cover some things that both group health plans and individual health plans have evolved over the years to include. If you only have Medicare Parts A and B, you won't have coverage for most outpatient prescription drugs, most dental care, dentures, most vision care, long-term care, routine foot care, or hearing care, including hearing aids. Since Medicare Parts A and B do not provide enough coverage for most people, other Medicare plans offered by private insurance companies have been introduced over the years by the government to give more options to Medicare beneficiaries. Medicare Part C is also known as Medicare Advantage plans. Private insurance companies contract with Medicare and provide plans that will cover your Medicare Parts A and B coverage. Instead of having your care managed by Medicare itself, your claims are processed and medical costs are covered by the independent health insurance company according to the plan's contract. Most Medicare Advantage plans provide coverage for things that original Medicare does not. These extra benefits do vary by plan. Medicare Advantage plans are highly regulated insurance products. Plan benefits and outcomes are scrutinized every year. Only plans that meet Medicare's standards are allowed to be offered to the public. Most Medicare Advantage plans have very low or even $0 monthly premium costs. You do still have to pay your Medicare Part B premium of $170.10 per month or more, depending on your income. But quite often, there is no extra cost involved beyond that of being enrolled in a Medicare Advantage plan. The plans can offer low or no premiums to consumers because Medicare itself pays a prescribed amount of money to the Medicare Advantage plan every month to manage the care for each enrolled beneficiary. Although there may be no monthly fee to be enrolled in a Medicare Advantage plan, these plans are not free. There are deductibles, copays, and coinsurance amounts that you will have to pay every time you receive covered medical treatment. In general, you do have to use network providers to receive medical care at the lowest cost to you. Medicare Advantage plans are required by law to have a maximum out-of-pocket spending limit. So even if you have a year with a serious illness or injury and require far more medical care than you usually do, if you reach the out-of-pocket max in your spending, the plan will pay all costs beyond that amount for covered medical care for the rest of the calendar year. Most Medicare Advantage plans will also include Medicare Part D. Part D is prescription drug coverage. Those plans are known as MAPD plans. There are also some Medicare Advantage plans known as MA-only plans that do not include Part D drug coverage. These plans can be a great option for people who have creditable drug coverage through another source, like an employer health plan or the VA, or a state pharmaceutical assistance program, or some other government program. Medicare Part D also offers standalone prescription drug plans. The standalone plans are for people who want Medicare prescription drug coverage but don't want to enroll in an MAPD plan. Like Part C, Medicare Part D plans are offered through private insurance companies that contract with Medicare. All of those plans have to be approved by Medicare before they are allowed to be marketed to Medicare beneficiaries. Some people have original Medicare Parts A and B and a standalone Part D plan, and that's it. However, most standalone Part D enrollees also have a Medicare supplement. Medicare supplements are also known as Medigap plans, and they do just that. They fill in the gaps in original Medicare Parts A and B that would otherwise be your financial responsibility. Medicare supplements work with Medicare Parts A and B to control and cap your out-of-pocket spending. It does get a little bit confusing because we have the parts of Medicare, which are A, B, C, and D, and then we have Medicare Supplement or Medigap plans, which are also named by letters, A through N, with some letters missing. The letter names for Medicare supplements are used in 47 states. There are 3 states that use different methods of naming Medicare supplements. For now, we're going to stick with the 47 states that use letter names A through N. Medicare supplements have standardized uniform coverage. So for example, if you decide that you want a Medicare Supplement Plan G, a Plan G sold by any company in your state will have exactly the same benefits. However, they do have very different premium costs from company to company. Standard Medicare supplements have no networks. You can see any medical provider who accepts Medicare. Most Medicare supplements are not allowed to include the extra coverage that is available in many Medicare Advantage plans. For the most part, Medicare supplements have higher monthly premiums than Medicare Advantage plans. But depending on the particular Medicare supplement lettered plan that you choose, there are very few extra costs to you through the year when you need medical care. The two major routes chosen by Medicare beneficiaries for extra Medicare coverage are either a Medicare Advantage plan that includes Part D drug coverage, or Original Medicare with a Medicare supplement plus a standalone Part D plan and possibly an extra dental, vision, and hearing policy. There's a separate video linked above that guides you through deciding which of those coverage options is best for you. If a Medicare supplement seems like the best fit for your situation, there's a video about 2022 Medicare supplements linked above that gives more specific information about finding the right Medicare supplement plan for you. Of course, you don't have to go it alone with any Medicare decisions. We're happy to help you from deciding when to enroll in Medicare, to assisting you every year while you're on Medicare to evaluate and comparison shop all available plans, to find the right one for you. And we do that all at no charge to you. If you have Medicare questions, feel free to give our office a call at 877-312-1414 or visit bcmwi.com. We're here to help you understand your Medicare options and find the best fit for your unique situation. Have a great day.